Thank you for your interest in North Mississippi Medical Center's Family Medicine Residency Program. Our mission is to train family physicians who are ready to provide comprehensive patient and family care and to make a difference in their communities. Our program was established with the support of North Mississippi Medical Center in 1994.
We are so honored to include the Family Medicine Residency as part of what we do at North Mississippi Health Services. Why are we the essential place for that program? Because we truly are the families of North Mississippi. We're not just a hospital, we're the largest employer. We engage in every part of each other's lives in Tupelo, and we're inviting you to be part of our family.
We have over 130 graduates who practice in family medicine ranging from outpatient clinic, emergency medicine, hospitalist, geriatrics, and sports medicine. We are a community-based program that offers outpatient and inpatient experiences to prepare you for autonomous practice.
Hey, I'm Dr. Leslie Smothers. I'm an attending here at the Residency Center. I finished residency here a couple of years ago. I went out to practice on my own. I practiced traditional family medicine. I did inpatient medicine, outpatient medicine, and clinic. I was very prepared. This program prepared me very well for practice on my own. But I decided that, it just was at home and I kept thinking about Tupelo. So I decided to move back to Tupelo. I joined the Residency Center again as an attending and made Tupelo my permanent home.
My name is Tyler Crosswhite and I'm a current second-year resident at North Mississippi Medical Center here in Tupelo, Mississippi. I'm from Tupelo, Mississippi, so when I was asked why I did this program, it was a tough choice for me just because my whole family's here. My brother graduated from this program. I originally wanted to get away a little bit, to kind of get away from a legacy that was already left before me, but then I came and I met the people here and it was hard for me to stay away. I mean, the biggest strength of this residency are the people, and since I've come here, I don't regret it at all. So the attendings are wonderful, the people are wonderful, and I honestly couldn't be happier to be back in my home city.
So one of the most important things in the world we can ever do is we can teach and we can learn. But medicine's unique because in medicine, when we teach and we learn, it involves a human life. It involves a soul, it involves a grandma, a grandpa, a mom, a child, and nothing represents that more than family medicine. Family medicine takes care of not only the person, but it takes care of the whole family. And that in itself is an honor.
North Mississippi Medical Center serves 24 counties and is one of the largest rural hospitals in the nation. This means you train in a facility with medical specialties and patient volumes you might only expect to find in large cities or in a university setting.
Hi, my name is Rasha. I was a resident at FMRC from 2012 to 2015, and I currently practice in Denver, Colorado. One of the first things I noticed when I visited FMRC during the interview process was that the residents were happy. And during my years at FMRC, the quality of life was great. There was an amazing work-life balance without sacrificing an incredible education. The residents were very supportive of one another, and we got great support from the attendings also, who really wanted us to succeed. Our education and work experience ranged from hospital medicine to outpatient family medicine to geriatrics to working with multiple specialties. My education at FMRC really prepared me for a wide scope family medicine practice. I wish you all the best, and I hope you consider FMRC.
My name is Ethan Collier. This is my wife Tori Collier, and this is our baby boy Rylan.
So things I've really enjoyed about this program, I kind of had a little bit of a different start than most people. I actually started on maternity leave and had Ryland, and I was really worried about how that would reflect on my intern year and if I would get the support I needed being a new mom and a new intern, and I absolutely did with this program. They had no problem giving me, full maternity leave, and once I came back, they scheduled time for me to be able to breastfeed during clinic, and They're incredibly supportive through the whole year. So I really appreciated that, and that was really awesome to see with this program.
Yeah, so one of the challenges of being in a program together is we both have very heavy schedules. So we're both working a lot, but I think this program does a really good job of giving us time off, and specifically works to give us time off together. I love having time off, but it doesn't mean near as much if I'm not able to spend it with my family. And so they work together to try to fit certain rotations where we can both of us take a significant time off and maybe go on a vacation together or something like that. And I think that's very important, and that was important to me. And another thing that the program's done really well is schedule us out with hard rotations, kind of spaced out to where one of us is on an easier rotation. That way, if anything ever comes up with Rylan, we can take care of them and stuff like that, and that works out really well.
Our program will encourage your learning, provide you with excellent role models, and share the opportunity to care for our patients. We will seek to promote your growth as a whole person who successfully enjoys life and balances the challenges of family, profession, and community. In your future, we want you to look back at our program as the start of a very gratifying career as a family physician.
Hi, my name is Dr. Charles Abbaviri. I work here at West Tupelo Medical Clinic, specifically the urgent care side. I came to Tupelo through the residency program. I went to medical school back in Virginia College of Osteopathic Medicine, and I came over here for my residency program. And well, after the program, my wife and I, we originally moved to Virginia from California, San Diego to be specific. And then when we got here to Tupelo, the environment here was just so right. Nice people, people are kind, and people more like people oriented. So we decided to stick around and also raise our kids here. We felt like it was the best place to raise children. And so far, we've not regretted our decision. Folks back home still wonder, why are you doing in Mississippi? I'm telling them, come visit, because you love it in here. It's a beautiful place to be.
Hello, my name is Courtney Ross, and I completed residency at FMRC in 2015. I feel that FMRC prepared me very well for outpatient practice, but more importantly for me, the experiences that I had in both acute and long-term care of the elderly led me to pursue a clinical geriatrics fellowship, in which I expanded upon the foundation that had been built through my residency training. I am now primary care physician to an outpatient and house calls panel in a geriatric practice in Jacksonville, Florida. I highly encourage you to consider FMRC for your family medicine residency training.
As you consider residency programs or are looking for a family medicine student rotation, we are confident that you will find ours to be one of excellence and one that prepares you well for the practice of family medicine.
Come join us at North Mississippi Health Services Family Medicine Residency Program and be our family.